Diarrhea can put you at risk for severe dehydration and electrolyte imbalances. It can decrease your blood pressure and it increases your risk for infection. It can cause chemotherapy dose delays or reductions. It can cause discontinuation of treatment and hospitalizations, and it affects your quality of life. It can be treated effectively if we treat it promptly. You will need to keep up your fluids, so aim for 10 to 12 cups of fluid a day. When you have diarrhea, you lose a lot of fluid. Have a low-fat, low-fiber diet with things like white bread, applesauce, rice. Soluble fiber will help build your stool. So things like fruits and vegetables, make sure they don't have their skins on them. Oat bran and barley will help. Eat small, frequent meals and avoid spicy fried foods. Insoluble fibers like the skin on fruits and vegetables. Loperamide, start with 4 milligrams followed by 2 milligrams every 4 hours after each unformed stool. Your max dose is 16 milligrams or whatever the doctor has told you to use. Continue with loperamide until you're 12 hours diarrhea free or unless the pharmacist or the doctor tell you otherwise. You need to protect your skin integrity. So cleanse your perianal area with warm water. Sometimes you want to use soap or not, doesn't matter, just a mild soap. After each stool, pat dry, don't rub. You might want to use a sitz bath with warm water and also use moisture barrier creams when needed to protect the skin. Record the onset and number of stools that you have in 24 hours. Again, diarrhea can be effectively managed with prompt intervention. Seek immediate medical attention if you have a temperature above 38, if you have bloody stools, if you have severe cramping, abdominal pain with or without nausea, if you have dizziness, weakness, confusion, excessive thirst, dark urine, you may be dehydrated and need some fluids. And if the diarrhea has not resolved with all of these strategies, you need to call us right away or go to the emergency department or your doctor or a walk-in clinic. Persistent grade 1, grade 2 diarrhea, not resolved after 24 hours, but you don't have a fever, you're not dehydrated, you don't have any blood in your stool, it still is urgent and you need to talk to a doctor within 24 hours. The doctor may order additional blood tests or stool samples to help determine what you need to take next. The doctor may prescribe additional medication based on the type of medication that you are taking.